What are the early signs of diabetes to watch out for? Hello friends, welcome back to our channel where we talk about health topics that matter most to you and your loved ones. I'm here today with some potentially life-changing information. Did you know that over 37 million Americans are living with diabetes and nearly 1 in 4 of them don't even know they have it? Even more concerning, adults aged 65 and older make up 26.8% of all diabetes cases in the United States. But here's the empowering truth. Diabetes doesn't have to sneak up on you. Your body often gives you warning signs months or even years before a formal diagnosis. Today, we're going to explore these early warning signs together so you can take control of your health and potentially prevent serious complications down the road. What is diabetes? Before we dive into the warning signs, let's take a moment to understand what diabetes actually is. Think of your body like a car, and glucose, that's sugar, is the fuel that keeps your engine running. Every time you eat, your body breaks down food into glucose and releases it into your bloodstream. Now, here's where insulin comes in. Insulin is like a key that unlocks your cells, so glucose can enter and provide energy. In a healthy body, your pancreas produces just the right amount of insulin to keep your blood sugar levels balanced. But with diabetes, this system doesn't work properly. Either your pancreas doesn't make enough insulin, or your body can't use the insulin effectively. It's like having a car with a fuel injection problem. The gas is there, but it's not getting to where it needs to go efficiently. When glucose can't enter your cells properly, it builds up in your bloodstream. Over time, these high blood sugar levels can damage blood vessels, nerves, and organs throughout your body. That's why diabetes can affect everything from your eyes and kidneys to your heart and feet. The good news, when caught early, diabetes is very manageable. Many people with diabetes live full, active, healthy lives. The key is recognizing the signs and taking action before complications develop. Why early detection is crucial. Now, you might be wondering, why is catching diabetes early so important? Let me share some compelling reasons that might surprise you. First, early detection can literally save your sight. Diabetes is the leading cause of blindness in adults, but when blood sugar is managed well from the beginning, this complication is largely preventable. I've met people who wish they had known about their diabetes sooner because they could have protected their vision. Second, your heart will thank you. People with diabetes are twice as likely to have heart disease or stroke, but early management dramatically reduces this risk. Think of it as giving your heart a protective shield. Third, it can save your limbs. Diabetes can cause nerve damage and poor circulation, particularly in the feet. In severe cases, this can lead to amputations. But with early detection and proper care, your feet can stay healthy for life. Here's something that really drives this point home. Studies show that people who manage their diabetes well from early on can reduce their risk of serious complications by up to 40%. That's almost half. These aren't just statistics. These represent real people living fuller, healthier lives because they caught their diabetes early. The American Diabetes Association estimates that delaying diabetes diagnosis by just 5 years can cost a person up to 6 years of life expectancy. But here's the flip side. People who manage their diabetes well can live just as long as those without diabetes. Now, what are the types of diabetes? Let's quickly cover the main types of diabetes so you understand what we're talking about. Type 1 diabetes typically develops in childhood or young adulthood, though it can occur at any age. With type 1, the immune system mistakenly attacks the cells in the pancreas that make insulin. People with type 1 diabetes need insulin injections to survive. While this represents about 5 to 10% of all diabetes cases, it's less common in older adults. Type 2 diabetes is what we'll focus on most today because it affects about 90 to 95% of people with diabetes and is most common in adults over 45. With type 2, your body either doesn't make enough insulin or doesn't use insulin well. This is often related to lifestyle factors and family history. Gestational diabetes occurs during pregnancy and usually goes away after delivery, but women who have had it are at higher risk for developing type 2 diabetes later in life. There's also pre-diabetes, which is like a yellow warning light on your health dashboard. Your blood sugar is higher than normal, but not quite high enough for a diabetes diagnosis. About 96 million American adults have prediabetes, and more than 80% don't know they have it. The early warning signs and what your body is telling you. Now, let's get to the heart of why you're here. Recognizing those early warning signs. I want you to think of these as your body's way of having a conversation with you. It's trying to tell you something important. Increased thirst and frequent urination. The most common early signs often go hand in hand. Excessive thirst and frequent urination. Here's what's happening. When you have too much glucose in your blood, your kidneys work overtime trying to filter it out. This process pulls extra water from your body body, making you urinate more frequently. Now, you might think, well, I'm drinking more water, so of course I'm urinating more. But it's actually the opposite. You're urinating more, which is making you thirsty. It's like your body is stuck in a cycle. Margaret, a 68-year-old grandmother I know, first noticed she was waking up 3 or 4 times every night to use the bathroom. She thought it was just part of getting older. Then she realized she was constantly reaching for her water glass, even keeping one by her bedside. These weren't separate issues. They were connected signs her body was trying to tell her something. If you find yourself drinking significantly more fluids than usual, we're not talking about a hot summer day, but consistently feeling parched, and you're making frequent trips to the bathroom, especially at night, it's worth paying attention to. Unexplained fatigue. Fatigue is tricky because we often attribute it to aging, stress, or just being busy. But diabetes-related fatigue has a specific quality to it. When your cells can't get the glucose they need for energy, it's like trying to run a car on empty. You might feel tired even after a full night's sleep, or find that simple activities leave you more drained than they used to. Think of it this way: if your body's energy delivery system isn't working properly, every task requires more effort. It's like trying to charge your phone with a faulty charger. It never quite gets the power it needs. Robert, a 72-year-old retired teacher, told me he started falling asleep in his favorite chair every afternoon, something he'd never done before. He thought he was just getting old, but it turned out his blood sugar was running high, leaving his cells starved for energy. Blurred vision. This symptom can be particularly concerning because vision problems can significantly impact your quality of life. High blood sugar can cause the lens in your eye to swell, changing its shape and affecting your ability to focus clearly. The important thing to understand is that this kind of vision change comes and goes. You might notice that your vision seems blurry in the morning, but clears up later, or that you need to squint more when reading. Some people find themselves holding books or newspapers at different distances to see clearly. Mary, a 65-year-old avid reader, first noticed she was having trouble with her crossword puzzles. The letters seemed fuzzy, and she found herself adjusting her reading glasses constantly. She assumed she needed a new prescription, but when she mentioned it to her doctor along with some other symptoms, it led to a diabetes diagnosis. Slow healing wounds and frequent infections. High blood sugar can impair your immune system and reduce blood flow, making it harder for your body to heal wounds and fight off infections. You might notice that small cuts or scrapes take longer to heal than they used to, or that you're getting more skin infections, urinary tract infections, or yeast infections than normal. For older adults, this can be particularly noticeable with minor injuries. A small cut from gardening or a scrape from bumping into furniture might seem to linger for weeks instead of healing within a few days. Unexplained weight loss. This might seem like a positive thing at first, but unexplained weight loss can be a warning sign, especially for type 1 diabetes or advanced type 2 diabetes. When your cells can't get glucose for energy, your body starts breaking down muscle and fat for fuel instead. If you're losing weight without trying, and I mean without changing your diet or exercise routine, it's worth investigating. This is different from gradual weight changes or intentional weight loss. We're talking about noticeable weight loss over a few weeks or months without explanation. Increased hunger. Paradoxically, even though your blood has plenty of glucose, your cells are starving because they can't access it properly. This can lead to increased hunger, especially craving for carbohydrates. You might find yourself feeling hungry shortly after meals or having cravings that seem stronger than usual. Tingling or numbness in hands and feet. High blood sugar can damage nerves over time, often starting with the longest nerves first, those that reach your hands and feet. You might notice tingling, numbness, or a pins and needles sensation, particularly in your fingers or toes. This symptom often starts subtly. You might notice your feet feel cold more often, or you have less sensitivity when touching things. Some people describe it as wearing invisible gloves or socks. Dark patches of skin, called acanthosis nigricans. These are dark, velvety patches of skin that often appear in body folds and creases, around the neck, armpits, or groin area. While they can be caused by other conditions, they're often associated with insulin resistance, which precedes type 2 diabetes. This is the most important part of the video. If you are already diabetic, it's not the end of the road. There are some recent research that proves that diabetes can be reversed in a matter of weeks or even days. If you want to know more about that, click the first link in the description or click the first link in the comment section. So now back to the video. How these symptoms show up in older adults. It's important to understand that diabetes symptoms can present differently in older adults. Your body changes as you age, and sometimes these changes can can mask or mimic diabetes symptoms. For instance, many older adults already deal with some fatigue, so diabetes-related tiredness might not seem unusual at first. Similarly, vision changes are often attributed to aging when they could be related to blood sugar fluctuations. Older adults are also more likely to have other health conditions that can complicate the picture. If you're already taking medications for blood pressure or heart conditions, you might not immediately recognize diabetes symptoms. There's also something called hyperosmolar hypoglycemic state that's more common in older adults with diabetes. This happens when blood sugar gets extremely high, leading to severe dehydration. Symptoms can include extreme thirst, dry mouth, warm and dry skin without sweating, high fever, sleepiness, and confusion. Here's what's particularly important for older adults. You might not experience the classic symptoms as intensely. Your thirst sensation might be diminished, so you might not feel as thirsty even when your blood sugar is high. This is why it's crucial to pay attention to subtle changes in your body and energy levels. Family members and caregivers play a crucial role here. If you're caring for an older adult, watch for changes in their bathroom habits, energy levels, mood, or eating patterns. Sometimes an outside observer notices changes that the person themselves might not recognize. Now, the question could be, when can we see a doctor? Don't wait for perfect certainty. Here's something I want to emphasize. You don't need to have multiple symptoms or severe symptoms to warrant a conversation with your healthcare provider. If you're experiencing any of these signs consistently for more than a few weeks, it's worth discussing with your doctor. The American Diabetes Association recommends that all adults aged 45 and older get screened for diabetes every 3 years, even without symptoms. If you have risk factors like family history, being overweight, high blood pressure, or a history of gestational diabetes, screening should start earlier and happen more frequently. But don't wait for your regular screening if you're noticing symptoms. Here are some specific situations where you should schedule an appointment sooner rather than later. If you're experiencing increased thirst and urination that's disrupting your sleep or daily activities. If you're feeling unusually tired for more than 2 weeks without another explanation. If you have cuts or infections that aren't healing as they normally would. If you're experiencing unexplained weight loss or gain. If you're having vision changes that come and go. When you call your doctor's office, be specific about your symptoms. Instead of saying, "I don't feel well," try something like, "I've been unusually thirsty for the past 3 weeks, and I'm waking up multiple times at night to urinate." This helps them understand the urgency and schedule you appropriately. Remember, diabetes testing is simple. It usually involves a blood test that can be done right in your doctor's office or at a lab. The most common tests are fasting, blood glucose, A1C, which shows your average blood sugar over the past 2 to 3 months, or an oral glucose tolerance test, the power of early intervention. Now, let's talk about why catching diabetes early is so powerful. When diabetes is detected in its early stages, or even in the pre-diabetes stage, you have tremendous opportunity to change the course of the disease. Let me share some encouraging statistics. The Diabetes Prevention Program, a major research study, showed that people with pre-diabetes who made lifestyle changes reduced their risk of developing type 2 diabetes by 58%. For people over 60, the reduction was even higher, 71%. These aren't small improvements. These are life-changing numbers. What kinds of lifestyle changes am I talking about? They're more manageable than you might think. Losing just 5 to 7% of your body weight, that's about 10 to 14 pounds for a 200-pound person, can make a significant difference. We're not talking about dramatic transformations, but sustainable, gradual changes. Physical activity is incredibly powerful too. Just 150 minutes of moderate activity per week, that's 30 minutes, 5 days a week, can dramatically improve how your body uses insulin. This could be as simple as taking a brisk walk around your neighborhood after dinner. Dietary changes don't have to mean giving up everything you enjoy. It's more about balance, portion control, and choosing foods that help keep your blood sugar stable. Many people find that working with a nutritionist or diabetes educator helps them develop an eating plan they can actually stick with. If lifestyle changes aren't enough, there are excellent medications available that can help manage blood sugar with minimal side effects. The key is starting treatment early before complications develop. I've seen people completely reverse their prediabetes, and others manage their type 2 diabetes so well that it barely impacts their daily life. The difference is almost always early detection and proactive management, debunking common myths and misconceptions. Let's clear up some common misconceptions about diabetes, symptoms that might prevent people from seeking help when they need it. Myth 1. Diabetes symptoms are always obvious and severe. Truth. Early diabetes symptoms are often subtle and develop gradually. Many people have diabetes for years without realizing it because the symptoms seem minor or are attributed to other causes. Myth 2. Only overweight people get diabetes. Truth. While being overweight increases risk, thin people can, and do, develop diabetes. About 10 to 15% of people with type 2 diabetes are not overweight. Myth 3. If I feel fine, I don't have diabetes. Truth. Many people with diabetes feel perfectly fine, especially in the early stages. This is why regular screening is so important, particularly for people over 45. Myth 4. Diabetes symptoms only affect blood sugar. Truth. Diabetes can affect virtually every system in your body, which is why symptoms can be so varied and sometimes unexpected. Myth 5. Natural remedies can cure diabetes, so I don't need medical care. Truth. While lifestyle changes are incredibly important and some natural approaches can be helpful as part of an overall treatment plan, diabetes is a serious medical condition that requires professional medical management. Myth 6. Diabetes is inevitable if it runs in my family. Truth. Family history does increase risk, but it doesn't guarantee you'll develop diabetes. Lifestyle factors play a huge role, and many people with strong family histories never develop the condition. Myth 7. Stress can't cause diabetes. Truth. While stress alone doesn't cause diabetes, chronic stress can contribute to insulin resistance and make it harder to manage blood sugar levels. Proactive health management, steps you could start taking. If you're at risk for diabetes or concerned about the symptoms we've discussed, there are proactive steps you can take starting today. Think of this as investing in your future health and well-being. Create a health journal. Start tracking symptoms, energy levels, and how you feel throughout the day. Note when you feel thirsty, how often you're urinating, your energy levels, and any other symptoms. This information will be valuable when you talk to your healthcare provider. Monitor your numbers. If you have a blood pressure cuff at home, use it regularly. High blood pressure often goes hand in hand with diabetes. Some pharmacies also offer free blood pressure and blood sugar checks. Focus on sleep quality. Poor sleep can affect blood sugar control and insulin sensitivity. Aim for 7 to 9 hours of quality sleep each night. Create a consistent bedtime routine and limit screens before bed. Stay hydrated, but pay attention. Drink plenty of water, but notice if your thirst seems excessive or different from normal. The goal is to stay normally hydrated, not to drink excessive amounts of water. Eat regular, balanced meals. Skipping meals can cause blood sugar swings. Try to eat at consistent times and include protein, healthy fats, and fiber in your meals to help stabilize blood sugar. Move your body daily. You don't need to run marathons. A daily walk, some gentle stretching, or even household activities like gardening count as physical activity. The key is consistency. Build a support network. Talk to family members about your health concerns. Having people who understand what you're watching for can be helpful, and they might notice changes you don't see yourself. Resources and support for seniors. You're not alone in this journey. There are numerous resources available to help you understand, prevent, and manage diabetes. Healthcare resources. Your primary care physician is your first line of defense. Don't hesitate to ask questions or express concerns. If you're diagnosed with diabetes, ask about seeing a diabetes educator or endocrinologist. Many communities have senior health clinics that offer diabetes screening and education programs specifically designed for older adults. These programs understand the unique challenges seniors face and can provide tailored advice. Educational resources. The American Diabetes Association offers excellent free resources, including educational materials specifically for seniors and their families. Their website has meal planning guides, exercise tips, and symptom trackers you can print out and use. The Centers for Disease Control and Prevention, CDC, offers a national diabetes prevention program with lifestyle change programs available in communities across the country. Many of these programs are specifically designed for older adults. Technology resources. If you're comfortable with technology, there are helpful apps that can track symptoms, blood sugar levels if you're monitoring, and physical activity. Many of these are designed with larger fonts and simple interfaces for older users. Community support. Look for diabetes support groups in your community. Many hospitals, community centers, and senior centers host these groups. Talking with others who understand what you're going through can be incredibly valuable. Local area agencies on aging often have resources and programs related to diabetes prevention and management for seniors. They might offer transportation to medical appointments, meal programs that consider dietary needs, or educational workshops. Financial resources. If cost is a concern, Look into Medicare coverage for diabetes, prevention programs, and supplies. Many insurance plans cover diabetes education and management programs. Some pharmaceutical companies offer patient assistance programs for diabetes medications, and community health centers often provide services on a sliding fee scale based on income. I want to take a moment to talk about the bigger picture here. Watching for diabetes symptoms isn't about living in fear or constantly worrying about your health. It's about being informed and empowered to take charge of your well-being. Think of it like maintaining your car. You pay attention to warning lights. You notice when something sounds different, and you take it in for regular checkups. This doesn't mean you're obsessed with car problems. It means you want your car to run well and last a long time. Your body deserves the same attention and care. By being aware of these early warning signs, you're not borrowing trouble. You're being a responsible caretaker of your health. Many people who are diagnosed with diabetes or prediabetes tell me that while the diagnosis was initially scary, it actually became a turning point toward better health. They started paying more attention to their diet, became more active, and felt more in control of their health than they had in years. Remember, diabetes is very manageable when caught early. People with diabetes travel the world, pursue new hobbies, spend time with grandchildren, and live full, active lives. The key is early detection and good management. What's the next steps? Let's create a simple action plan based on what we've discussed today. This week, take a moment to honestly assess whether you've been experiencing any of the symptoms we discussed. If you have, don't panic, but do take note of when they started and how often they occur. Talk to a family member or close friend about what you've learned. Sometimes they have noticed changes in you that you haven't recognized yourself. This month, if you're experiencing symptoms, schedule an appointment with your healthcare provider. If you're not experiencing symptoms, but you're over 45 or have risk factors, ask about diabetes. Screening at your next appointment. Start or continue healthy habits. Regular physical activity, balanced eating, adequate sleep, and stress management. Ongoing. Pay attention to your body and any changes in how you feel. Trust your instincts. You know your body better than anyone else. Stay informed about diabetes prevention and management, but don't let it consume your thoughts. Knowledge is power, but worry without action isn't helpful. Keep regular healthcare appointments and maintain open communication with your healthcare team. Knowledge is your best defense. As we wrap up today's discussion, I want you to remember that knowledge truly is your best defense against diabetes complications. By understanding these early warning signs, you're already ahead of the curve. The symptoms we've discussed today, increased thirst and urination, unexplained fatigue, blurred vision, slow healing wounds, unexplained weight changes, increased hunger, tingling in hands and feet, and dark skin patches, are your body's way of communicating with you. Listen to these signals, but don't let them create anxiety. Remember, diabetes affects millions of people who live healthy, fulfilling lives. The difference between those who thrive and those who struggle with complications is often simply early detection and proactive management. You have the power to take control of your health. Whether you're watching for early signs in yourself or a loved one, this knowledge can be life-changing. Early detection can prevent complications, preserve your quality of life, and give you many more years of health and vitality. If anything we've discussed today resonates with you, don't wait. Trust your instincts and have a conversation with your healthcare provider. It could be the most important conversation you have this year. Thank you for spending this time learning about your health. Remember to like this video if it was helpful, subscribe for more health content tailored for you and your loved ones, and share this information with family and friends who might benefit from it. Take care of yourselves, and remember, your health is worth paying attention to. Until next time, stay healthy and stay informed.